the organizers for this wonderful academic fiesta. Thank you, Dr. Weber, for this insightful talk, and you have really made us proud. Now, coming us back to the non-communicable diseases, and now we have to, with the increasing prevalence of non-communicable disease and their implications, both in terms of global health, the disability-adjusted life years, and the cost, we have to shift our focus towards the risk factors at the same times of all the major risk factors that are known to affect the prevalence and the burden of non-communicable disease. Physical activity turns out to be the most important and yet the least talked about. So in my presentation, I'll be focusing mostly on defining physical inactivity and sedentary behavior. Because mostly when in our clinical practice and during the prescriptions, we tend to synonymize both the terms while the two are different and the two impact in a different manner. So we are going to talk about that a little bit, and then we'll be talking about the burden of physical inactivity and sedentary behavior, followed by the health implications of physical inactivity and our way forward. So, as my professor from pharmacology during my MBBS days used to tell us, the land with MPS syndrome. So, MPS means meat, paneer, sharab syndrome. Few kgs won't matter uh, until we pay a cost. There is always a cost of increased weight in the global level that we do not realize of large, but yes, we have to talk about it. So, what is physical activity? It is any bodily movement produced by contraction of skeletal muscles that result in a substantial increase over the resting energy expenditure. This is the definition as per the American College of Sports Medicine. And exercise is a type of physical activity which is planned, structured, and repetitive bodily movements done to improve or maintain one or more components of physical fitness. Now, if we are not able to do an inadequate physical activity, should we label this as physical inactivity or sedentary behavior? So this is a confusing term for me, had been for me for quite some time. But now, let us clarify this concept. Now, these are two similar looking but distinct concepts. Physical inactivity refers to not meeting the recommended physical activity levels set by the health guidelines, such as 150 minutes of moderate intensity activity per week. This is as per the WHO. Examples could be not engaging in activities like walking, cycling, swimming, exercise that meets activity guidelines, whereas sedentary behavior is any activity that involves very low energy expenditure, or to be precise, less than 1.5 METs. For example, just to give you a context, if you are lying completely, lying at bed at complete rest, the energy expenditure is approximately 1 METs. And while when we are doing a brisk walk, the energy expenditure is 5 METs. And when we are doing a jogging or running at minimal speed, very substantial speed of it will be 9.8 METs. So this is how we define physical inactivity and sedentary behaviors. To summarize, sedentary behavior can occur in physically active and inactive people both. So someone may be exercising for 30 minutes a day, but still be sitting for longer periods. So he'll still be having a sedentary behavior. And the latest evidence tells us even doing a workout in gym for 30 minutes or more cannot negate all the negative effects of sedentary activity. So it is how much important it is to work in the gym. Equally important is to not to adopt the minimal sedentary behavior. So physical inactivity means not exercising enough, but it doesn't necessarily mean the person is always sitting or lying down. Both contribute to health risks, but addressing them may require different strategies, reducing sedentary time and increasing overall physical activity. This is in crux the overall difference between the two. So now, why are the health differences in the health implications? I am not active, I am physically inactive, I am having a sedentary behavior. It is because they adopt a different physiological pathway of their implications. Sedentary behavior directly impairs muscle activity and metabolism in the ways that are distinct from those caused by physical inactivity. For example, even a physically active person can experience negative metabolic effects if they sit for long periods. So cumulative effects, physical inactivity will lead to broader declines in fitness, strength, and overall cardiovascular health, while sedentary behaviors affects metabolic effects and can accelerate the insulin resistance and the fat storage. So the difference in health, the implications, I have compared the possible pathways that are available in the literature that tells us how the two react expresses themselves. Physical inactivity will be acting by targeting muscle atrophy, loss of strength, impairing the cardiovascular function, increasing resistance and type 2 diabetes. It will be causing lipid dysregulation. Then it will be followed by weight gain and obesity, and also impacts your bone health. While sedentary behavior, the effects are more subtle and they are more at micro levels. They will be physical sedentary behavior targets by reducing the muscle contraction. They targets the enzyme activity, decrease the BMR, the basal metabolic rate, decreased lipoprotein lipase activity, which is essential for metabolic pathways, and impaired glucose regulation. Sedentary behavior also have a postural effect and leads to venous stasis, and ultimately at the end they cause disrupted hormonal balance by targeting hormones like leptins and adiponectins that are essential for maintaining the satiety and hunger. Now, coming on to the burden of physical inactivity and sedentary behavior, as per the global estimates, the prevalence of insufficient physical activity was 27%. So, 1 out of every 4 person was insufficiently physically inactive. The prevalence was higher in males compared to the females. This picture specifically depicts the geographical disparities in the physical activity patterns among the males. Now, if we look at the males of the India and then compare it with the males of the females of the India, we can see in contrast to the findings from the global literature, we can see that females in India per se, they are more physically inactive. So we have to look at the societal aspects that leads to decreased physical activity among the females. We have to look at different aspects like the social security. Our females cannot go for a run because of the security issues. They have high traffic, they are overburdened by their household chores, and so many things that we have to look at. So the differences in health implications between the two, while both sedentary behavior and physical inactivity contributes to poor health, the mechanism of harms and specific health outcomes, they differ. This we have seen. In a recent study by one of my co-authors from Netherlands, they have shown that even small spurts of physical activity during your daytime, like completing 4 minutes per day of incidental vigorous physical activity or 31 to 65 minutes of incidental moderate physical activity. This is just not taking the lift and going by the stairs, just taking your bucket, just doing your household chores all by yourself. These small spurts of physical activity that we usually do, and we try to seek help of house helps. If we are able to do these small spurts of physical activity, we can decrease the cardiovascular risk from high sedentary behavior. So these small spurts of physical activity would be important, and you should not be shy to take a lift to stairs and avoid a lift during your regular working hours. Now, coming on broadly to the health implications of physical inactivity. So, physical inactivity, it is going to affect anything and everything in your body, right from the musculoskeletal, as we had discussed, the metabolic health. Physical inactivity um, has a mitogenic activity by increasing insulin resistance. Then it affects your mood, the mental health, and the masculine stature of the body. Another study from the global burden of disease suggests that physical activity, inactivity is related to many diseases as much as we can think of, like uh, it has been linked to hypertension, depression and anxiety, dementia, cancer, stroke, type 2 diabetes, coronary heart disease, and so on. There are the innumerable implications of physical activity, but these are the major ones. Now, this figure tells us the number and proportion of new cases of non-communicable diseases and mental health conditions attributed to physical inactivity alone by WHO region-wise. So here we can see this in Southeast Asia, 21% of such cases they are attributed to physical inactivity. So this also tells us how much important it is to be physically active. Coming on to the implications of physical inactivity, the physical inactivity, it increases the risk of cardiovascular diseases, obesity and metabolic syndrome, type 2 diabetes, mental health issue. In one of the studies that I was given an opportunity by Dr. Sanjay Kalra to work upon, where we have analyzed the ICMR India Diab study data from Haryana only. We were looking at what was the epidemiology and pattern of physical activity in the land of that produced the maximum number of athletes. Within this study, it is still unpublished and has been submitted. So we can see that there are substantial differences in the blood pressure, the waist circumference, the BMI, the blood glucose level among physically active and inactive people. So this is another line diagram that depicts the dose response curve, and that tells us the decrease in death rate with every increase in the number of physical activity in the population. And another study done from in the OPD, the NCD clinic of the OPD of AIIMS Bathinda, we observed the effect of physical activity on mental health, and where we have seen substantial odds of having depression among physically inactive people. We could not find effects on anxiety, but the other literature, global literature, suggests that it has equivalent effect on anxiety as well. So this tells us that physically inactive affects your mental health. Physical activity has been proven to slow the early memory declines in Alzheimer's disease, as can be seen by comparing the healthy brain and the advanced Alzheimer's disease. Now, what is the cost of physical inactivity? So, as per the estimates, 500 million new cases of preventable major NCDs would occur by 2030 if the prevalence of physical inactivity does not change, with direct healthcare cost of around 520 billion. Just to give you a perspective, the overall global health spending was 9,800 billion. So it is a major chunk that is attributed to physical inactivity. Then the same article suggests that global cost of inaction on physical inactivity would reach approximately 47 billion per year. To give you a better perspective, in last year, our total health budget was 10 billion. So it is beyond our imagination, the cost of physical inactivity, and even though we have to take the early cognizance and while we are sitting in our OPD, may it be any OPD that you're looking at, we have to motivate our patients to be physically active. So now, how we can work upon to increase physical activity. Like I said, uh, just prescribing do physical activity is not sufficient enough. We have to activate the systems with governance, leadership, ownership policies. Like if I suggest Dr. Vitull going to the schools and ensuring that none of the school is missing their PT classes and none of them are being hijacked by the maths teachers to complete the syllabus, so that we can ensure at least 1 hour of physical activity every day in our schools. So we will be able to at least make our children used to physical activity, and so uh, um, they are not ready to sit idle and they enjoy being physically active. This is one thing that we have to do at a bigger level. At the same time, we have to activate the drivers of physical activity that has a active society, which includes community support, active environments. We need to have better parks. We need to advocate towards this. If all the doctors they advocate for better parks in the community, so we will be able to make a difference. And then activate the people, the program and services in all key settings that are ultimately going to improve the behavioral outcomes and have better societal impacts in terms of health and well-being, social development, sustainable environment, economic growth, and reduced inequalities. Um, that's all from my side. Thank you.
So thank you, Dr. Madhur. You have very well highlighted the importance of physical activity as well as inactivity. So we should take every opportunity to do some physical activity. Otherwise, mere discussion about the risk factors will not be enough. So Dr. Madhur has done a lot of activity, publications and research related to obesity. So I congratulate him for nice presentation. Thank you.
No, it was a very motivating talk.